Brian Isetts is a professor at the University of Minnesota College of Pharmacy. He has also served as a fellow at the Center for Medicare and Medicaid Services. Recently, he spoke at the PPSI Annual Breakfast Meeting. His topic: how do we get better health care at lower cost?
When pharmacists provide comprehensive medication therapy management services in interprofessional teams, we get outstanding clinical outcomes with reduced expenditures. So we're redesigning systems to support pharmacists' expectations. As I said, this move from fee-for-service to value-based is good for patients. And when it's good for patients and it has to do with their medicines, we're front and center. It's time for us to step up. But the message is we have to step up and deliver and exceed expectations, exceed our service level expectations. We talk about our return on investment. Outcome studies have served us well. We're learning many lessons from pharmacists in high-performing accountable care organizations and other value-based systems. This transition of care focus on drugs also is having a side effect. Not only are we decreasing readmissions, we're also decreasing what? Admissions as well. Because you're building systems that keep patients healthy and out of the hospital. That's what patients want. And there actually is provider recognition. We have that already in the Affordable Care Act. In fact, the Affordable Care Act and the regulations say that any healthcare profession can send a letter or petition to the Secretary of Health and Human Services requesting inclusion in value-based financing and reimbursement. Why haven't we done that? And then this urgent call to action that is really highlighting the harms and the need and the work that needs to be done. And one of the things that my colleagues at CMS lament all the time is, you know, Brian, people come here routinely every day. They knock on the door, and what's their message? You pay me more, and I'll give you more care. That hasn't worked for this country. But as we work together and collaborate to improve quality, we also can reduce costs. We're currently in Dr. Schondelmeyer can correct me, somewhere around 17% of our gross domestic product. Thank you, Dr. Schondelmeyer. He tilted his head sideways. Good enough. It's close. And we can decrease that down to at least 15% by improving quality. And then that will release other resources for our schools and for other social programs. And that's what's so important. Our healthcare system is putting a drag on our society. We aim of better care for individuals, better health across populations, the prevention. Let's not wait until you're sick as a dog and then you get health care, all right? Fall off the cliff. And by giving better care for individuals, improving population health, we can do this at lower per capita expenditures. So here's what excites me, the indicators of progress. We talked about this collaboration amongst our government partners. Reimbursement reform. We can't go along with volume-based reimbursement. We're not sure what outcomes-based or value-based reimbursement will look like 5 years from now, but we're on the path. So the shared savings have a finite limit. You know, after I can only share savings for so long, there's no more savings, but our reimbursement system will be based on how well patients do. We're moving in that direction. That's good news for patients. This emphasis for patient and family engagement, really what Don Berwick did was just amazing, so that we will actually have a patient on every board of directors in every hospital in this country. That's pretty cool. And so that listen to the patient's voices. It has been a little painful, I don't mind telling you, because we have hurt a lot of people. And so I should invite them to come in. They need to tell their story of how they've been done, the wrongs that have been done by the healthcare system. And so to build healthcare systems around the individuals, the end users, we have to then bring them in and let them tell their story so we can improve. And then this dynamic systems redesign, using the same principles that we've used in the airline industry, apply them finally to healthcare. So we routinely achieve goals of therapy with zero tolerance for preventable harms.
Please visit us at drugtopics.com, join us on Facebook, and follow us on Twitter.